Hey everybody, welcome back. So today's video is going to be an introductory, so a basic video that's going to outline a new series. That new series is called the Pain Series. And I am Dr. Kevin.
I'm Coach Sean.
And we're the FitHealth Pros. And what we want to do today is go over different types of things where we're going to help define pain. We're going to show you what pain syndromes may be, ways to reduce the pain, to eliminate pain, and even ways to prevent pain. So when doing research, we found that there were 7 main areas that we found to delineate and give you information.
Now, this series is really about answering some questions. Both my clients and Kevin's patients over the years have asked a lot of questions about pain. They've seen various practitioners, specialists, experts, and they may not be able to get to the bottom of why they're in pain, how they got in pain, how to get out of this pain, how to prevent that pain. So hopefully over the course of these videos, we don't know how many videos at this point, it could just keep growing and growing and growing until one day we stop, or we might have a finite number eventually. But the important part is we're listening. We want to hear your questions in addition to all of our clients' questions as well.
Correct. So let's go ahead and outline the 7 areas for everybody.
Okay, so the first thing we're going to talk about in these videos are going to be, say, the specific types of pain. We're going to have videos defining, what is pain? I mean, who knows exactly what pain is? Well, there are different categories of pain, and we're gonna have a couple videos that talk exactly about that. We're gonna talk about how a specific pain kind of relates to itself, and how it relates to the rest of your body, how it relates to your mind, how it can take you down. We're gonna have site-specific videos related to anything from lower back pain to knee pain to shoulders, etc. We're also going to go into different levels of pain and how that can affect your mind, body, spirit.
Yes. So the second area, and this is a big one, is what is causing your pain. So the kind of the why, the how, the when, the where. So when did it first present? What were you doing? In my profession, and when we do a consultation, we want to know what time of day, is it worse, what's the frequency, what's the intensity. So we'll get into that as well. Are we putting ourselves in harm's way to cause this pain? We want to look at that as well.
Yeah, that's part of that prevention right there.
Right. Oh, and then also the short-term versus long-term. We want to find out that as well.
Yep, how long that pain has been settled in.
Mm-hmm.
We're also going to talk about who gets these pains. We're going to talk age specifically, activity specifically. In terms of specific age groups, is it more common for the elderly to get the specific pain? Athletes, kids, teens, other decades of life, depending on, say, the stress or sleep patterns within those areas of life as well. We're also going to talk about those specific activities such as sports, jobs, vacations. I wasn't sure if I was going to put this in, but I got to. Say you go on a vacation, you don't swim all year, and then all of a sudden you're on vacation and you think you're Johnny Weissmuller and you pull muscles in your back. That is very specific to activities. Home and yard work. Again, you're not used to doing physical labor, and then you're going to put a tree into the ground and dig that hole. Accidents. Dr. Fox has many people coming into his practice where the pain is directly related to accidents.
Right, car accidents, slips, falls, even riding roller coasters, can do the same thing.
Yeah, whiplash, maybe.
Whiplash. All right. Now, the fourth aspect, the fourth area, is the treatment part. So there's various treatment options. Who do you go to first? Who do you go to second? So everyone's going to make these decisions kind of based on possibly the intensity of the pain, who you know, who you're comfortable with, what your history is with different doctors and providers.
Sure.
So there's MDs that specialize in pain. chiropractors, physical therapists, personal trainers, acupuncturists, massage therapists, even dietitians and nutritionists can come into play with this. Now, within those various practitioners and treatments, we'll get a little deeper dive into that.
Yeah.
But mainly, there's two types of treatments. And this is not including self-care, which we'll go into here and down the road. But there is passive care and active care. So passive care is going to be something where you're doing it on your own, or you're having someone work on you. So if Sean was going to do stretching for you, that would be a passive exercise. If I was going to do an adjustment, that would be passive to you. And those are usually things that, from a therapeutic standpoint, may be soothing, like hot, cold, a light massage, compression. So things that are going to be almost the first aid aspect of it. Now the active care, that's where we really start seeing some changes, and when we know that we can make some preventions for the future and make sure that your structural integrity changes, your function is changing, and those active care, now you're moving, now you're doing dips or squats, or you're doing the stretches, and that would be the difference between the passive and the active care. So that's the treatments.
So, and speaking of self-care, well, let's go right into that. So this is in terms of when the injury first happens, and over time when you're not having a practitioner work with you or on you. Of course, we're going to go with the standard RICE, rest, ice, compression, elevation. And then, of course, when you're talking about ice, you're also going to talk about heat as well. There are two different ways to get that inflammation down through self-care. Self-massage, light range of motion. Again, when you have somebody working with you with range of motion therapy, they'll know exactly how far to push you. So if you're doing it yourself, you're going to want to back off a little bit and do it lightly. Foam rolling is another one too, that self-myofascial release, where it's a massage that you can do for yourself utilizing a foam roller.
Right. And then I do want to stress that we'll go into, when we get into the types of pain or different areas of pain, I recommend that self-care is after the care that you get by a different provider, depending on the care. I mean, if it's something very, very mild, that's why we want to add that in. But no way are we saying that every pain syndrome that you should be starting out working on yourself.
It could be the difference between having that short-term versus long-term, where you have something pop up and instead of going to see a provider, you try to do it on your own. Well, guess what? That just lengthens both possibly the intensity of the pain and the duration of the pain.
Correct, and it can be something, sometimes these pain syndromes can be something very severe if not properly diagnosed. So you want to make sure you get that done, diagnosed by a professional. So number 6 is going to be something that a lot of people don't really think about when they're in pain, and that is nutrition aspect. So based on our research and based on how pain comes about, there is almost 100% of the time inflammatory processes going on. Yeah. Whether it's at the direct area of trauma or around the area. It's the body's way to start the healing process and that protective mechanism. So here's what we know. We know that there's foods that help with an anti-inflammatory environment. So whether you eat those every day, increase your intake, or take supplements, those are out there. We'll go into that for you. There's also herbs, vitamins, minerals, enzymes, a lot of different nutrients that have healing properties, pain relief properties.
Sure.
And within that scope, pain relief, anti-inflammatory, healing the soft tissues, providing an environment for those soft tissues to not just heal, or not just feel better, but to actually change the chemistry and the physiology of those tissues. that could be the difference. Again, we're talking one time, and that can be the difference of a short-term recovery and a long-term, issue that just persists and nags. So I find nutrition to be a very good aspect of this.
Yeah, it's kind of exciting. Not a lot of people hyper focus on that, so we're going to be throwing that into the videos as well. Finally, we're gonna talk about kind of that final healing. What are the possible times that it would take to heal certain maladies? And is it possible for a totality of healing, or is it going to be something that is just kind of niggling for, the rest of your days? We want to be realistic about that. These vary from person to person, depending on age, activity, possible secondary elements going on, the body's natural healing response. That's very individual. The severity of the injury in the first place. And then we get into kind of the client's part of things, where it's how much attention and how much effort is the client giving to the rehabilitation, to the healing response. And lastly, kind of the quality of the provider. I mean, just like there are good teachers, there are good bus drivers, there are good and bad doctors and other practitioners as well. So that can affect both the amount of time it takes to heal and the totality of the healing itself.
So that's a quick overview of what we're going to be talking about. Again, there's going to be 7 main areas.
Yep, we're talking about the types of pain, who gets the pain, self-care, the final healing aspect of it that I just went over.
Right, and causes of pain, the different treatments, and even nutrition. And we feel that this information is going to be vital and can help people really live more comfortable lives and have a longer lasting, healthy lifestyle.
Yeah, and answer questions. That's, the questions that you ask us, hopefully we can make some videos on, but hopefully there will be videos that we put out there that can help you or can help a wider, more general populace.
So that's basically it for today's video. Of course, we're going to have probably the first symptoms starting right away. It will pop up right after this and lead you right into the series. We're going to start with 2 parts of definitions of pain, correct?
Yeah, what is pain, part 1, part 2. Be sure to subscribe to us as well. We have a variety of other videos and other series as well, but we also want to make sure that you are kind of given the information on what we have available right now, today, in terms of pain in this pain series.
Yep. And so that's it. I'm Dr. Kevin.
I'm Coach Sean.
And we're the FitHealth Pros. And we welcome you if you're starting. And thank you for watching us if you've continued to watch us through other videos. And that's it.
Ba-boom.
Ba-boom. Thanks, guys.
Thanks, everybody.
We'll see you. Hey, Sean, how are you?
I'm doing well.
Doing well.
You ready for another video?
I think this is going to be a good one.
How about another series of videos?
Very good. Hey, everybody. Welcome to Start Over.
Welcome to Starting Over with Dr. Fox and Coach Sean.